Damien and Saskia V on Mix 93.8.
We have Dr. Marissa Stadler in studio. She's the General Manager of Health and Sleep Renewal, which is a part of Renewal Institute. So we've got Healthy Me on the way. You'll have your tip for the day. But it's so nice to have people from Renewal Institute in studio to really chat to us and get a better idea, because I think a lot of people do get confused because of all the different, what do you call them, the different departments of Renewal Institute. So thanks for coming to chat to us today.
Thanks, Saskia. Thanks. It's nice to be here.
So obviously your forte is health and sleep renewal. So we're chatting today about the overnight sleep study launch at Renewal Institute. What is an overnight sleep study? How does it work?
So overnight sleep study, or also called a polysomnogram, it's a procedure which monitors body functions while you sleep. So body functions such as brain waves, your heart rate, your leg movements, and your breathing. So while you sleep in the overnight sleep clinic, you get monitored by a sleep technician who stays with you the entire night. And at the Renewal Institute, our overnight sleep study takes place in our sleep clinic in Morningside. It's soundproof hotel rooms with ensuite bathrooms. And then we also use FDA-approved equipment. After the sleep study or the night that you've done in the room or in the clinic, the recorded data will be scored then and calculated by a neuro physiologist who's got more than 20 years of experience in the sleep industry. And then the report gets signed off by, listen to this, a pulmonologist, Dr. Grace K. Eddy. Fabulous, eh?
Sure. So Marissa, who would be sort of the perfect candidate for an overnight sleep study?
So I would say anyone having trouble sleeping or staying asleep or feel sleepy, as well as everyone with a sleep disorder. Remember, the first step in treating a sleep disorder is recognizing that there's a problem. And at the Renewal Institute, we diagnose a sleep disorder in adults, teenagers, and in children. And then we facilitate the treatment plan through integrative medicine, looking at the symptoms that the patient has, but also looking at the underlying causes of the disorder.
Of the sleep problems.
Yes.
So what would sort of some of the typical sleeping conditions be that you diagnose in the sleep study?
Well, with a polysomnogram, or in short, we call it a PSG, we can diagnose sleep conditions such as obstructive sleep apnea, upper airway resistance syndrome, insomnia, parasomnias, narcolepsy, restless legs, REM sleep behavior, and even sleepwalking, just to name a few.
Sleepwalking. So is this quite common?
Yeah, it is common.
So, okay, what sort of services do you offer at Sleep Renewal? So now, if I come, have the sleep study, then what happens sort of after that?
So I have to differentiate between two different categories. The first one is at our Morningside Sleep Clinic, where we've got the overnight sleep rooms. We obviously offer the overnight sleep study in our hotel rooms. And then we also offer, in those rooms, we offer a multiple sleep latency test. It's actually, you can also call it a snooze study. Very interesting.
Yeah.
In short, this test measures how quickly you fall asleep in a quiet environment during the day. So you would sleep at night, and then you will also sleep at daytime, but we will wake you up and let you sleep, and wake you up and let you sleep. So we test how quickly you go back to sleep. So that's testing for narcolepsy.
Oh, I see.
And then we also do standard EEGs, which is a non-invasive test. We look at the electrical patterns in your brain. We diagnose things such as seizures, epilepsies, head injuries, brain tumors, and so forth.
We're chatting to Dr. Marissa Stadler. She's the General Manager of Health and Sleep Renewal, which is a part of Renewal Institute. So now I come in for the sleep study and I'm diagnosed with whatever, say I have sleep apnea. Which sort of treatments do you then offer? Because obviously only the first stage is the diagnosis. You then have to be treated for this.
Sure. It's very important that all patients receiving a sleep study at the Renewal Institute always get booked with a medical doctor who will discuss the diagnosis and discuss the treatment plan, and then also follow up regularly with these patients during the treatment. And then for the treatment options, we offer brain mapping and neurofeedback, which is a tool to identify problem areas in the brain related to trauma, anxiety, and then also stress. And by doing these exercises, brain exercises, you can improve your quality and your quantity of sleep. Then also, although very important, a primary treatment option for sleep disorders is a CPAP device. But at Renewal Institute, we do not sell CPAP devices. However, we facilitate the process when a patient needs a CPAP.
Okay, so you'll go through what exactly does a CPAP do?
Yeah, I thought you were going to ask that. So a CPAP is a device which maintains a continuous positive airway pressure throughout inspiration and expiration. So this device ensures that you don't stop breathing during sleep, or that your airway do not collapse, or that you don't get an obstruction in your airway. So it opens up the airway. For breathing, for proper breathing.
But now, is it quite uncomfortable? I've mentioned this to my husband. He snores a lot and I think he might have sleep apnea, but he says, I'm not going to wear this forever. Do people get used to it? It is quite a thing to wear this now every time you sleep.
Oh, yes, for sure. It is. Compliance is everything, and also comfort. So it's very important, and that's also what we help with at Renewal Institute. We collaborate with multiple medical companies to get you the best device and the best mask to help you to feel comfortable.
Yeah, because otherwise you're just not going to use it at the end of the day.
For sure. And over the years, these devices have become smaller, lighter, and even quieter. So you would actually be surprised to see, when you see these equipment, it's really not noisy, it's very comfortable, and people need to adapt. It's like riding a bike.
Yeah, and I suppose once you notice the benefits, so that's the thing. So there obviously are benefits, and you see this with people that come in for the sleep studies. What sort of benefits can you expect if you are somebody that has a sleep disorder? What can you see going forward once you've been diagnosed and you've in treatment?
When it comes to benefits of using a CPAP, it will obviously help you to cure your chronic conditions that you're suffering from, because the moment when you're using a CPAP, you put your heart at rest. It push your heart rate down. Okay, so the moment when your heart is resting, at that moment your body starts resting, and then all the other things in your body gets cured,
because that's it. So I think a lot of the problems that you think is not related to your sleep will be related to your sleep. So you often think, no, that's unrelated, that I feel like this, or that I'm putting on weight, or that it can all be related to that.
Conditions such as diabetes, insulin resistance, cardiovascular diseases, all those diseases are linked to sleep apnea.
It's fascinating. Hey, Johan says, I have sleeping issues. My wife says I stop breathing in my sleep. So that's exactly it. So that would be sleep apnea then, hey?
Yes, correct.
Okay, so he could come in for a sleep study. You still offer the at-home studies as well.
Yes, correct. So at-home study,
do both,
so at-home study we offer at all our other branches, so including the Morningside branch, because we only have the facilities currently in our Morningside branch. So with a home-based sleep study, a patient would come in to a branch, and a sleep technician will give you the device and explain to you how to use it at home. Okay. And then the recorded data at home, when you bring it back, we extract those data, we use that to write a report and then to diagnose sleep apnea, and then follow through with consult and treatment plan.
Sure. Okay, so if people would like more info, so somebody like Johan that thinks, okay, this is something I need to do, how can they find out more, Marissa?
On the website, www.renewalinstitute.co.za, or then sleeprenewal.co.za.
And you've got lots of branches, so you'll find something that's close to you.
Yes, we've got 16 branches nationwide. So KZN, Cape Town, and in Gauteng.
Okay, so sleeprenewal.co.za. Otherwise, go to Renewal Institute, and you'll see on Renewal Institute, it's got all the different things at the bottom. So you can click on sleep, or skin, or brain, or there's a health. Yeah, so there's so many. So you can also just go and have a look and see what is on offer at Renewal Institute. But this has been fascinating. I will send my husband for sure. One day. Dr. Marissa Stadler, General Manager of Health and Sleep Renewal. And thank you so much for coming to chat to us.
Thank you so much. It was wonderful. Thank you.
Damien and Saskia V on Mix 93.8.